Cosmetic surgery can be expensive. Patients would like to save money on cosmetic surgery, and that's completely understandable. But going abroad, even when it's with a U.S. licensed doctor performing the procedure in another country, may not often end well. And I'm not just talking about life-threatening or potentially fatal outcomes, because those do happen. More often, it's getting results that simply don't live up to your expectations. There's research showing just how common this is. A review of patients who traveled abroad for surgery found that many of them come back with serious complications. Things like infections, healing issues that stemmed from poor preoperative screening, less than optimal surgical environments, and a lack of follow-up care. And those great deals? Those don't often factor in the hidden cost of complications once you're back home. One study looked at 41 patients in the US who had their surgeries done overseas and then needed medical treatment here. The most common issues were seromas and infections. Together, the cost of managing those complications was more than $500,000. So while the surgery itself may have been affordable, fixing the problems definitely wasn't. Even if you're not faced with a medical emergency, the outcomes themselves often fall short. There's no structured follow-up care, the standards of care can be different, and language or logistical barriers add another layer of challenges. Things like scarring, asymmetry, or poor healing are much more likely when the whole model is built around low upfront prices and a vacation vibe, rather than safety and continuity of care. Here's another important point. A lot of people think that if a surgeon is US licensed, they'll bring US standards with them abroad, but that's not guaranteed. The facility itself might not meet US or international accreditation standards. Post-op care and emergency protocols can be inconsistent or even non-existent. And traveling shortly after your surgery increases risks of complications like blood clots without reliable monitoring in place. So before you book, here's what you really need to know. Make sure you know exactly who your surgeon is. Meet them in advance, even if it's through Zoom or video. Confirm that they're board certified, either through an American Board of Plastic Surgery here in the US or the equivalent in their country. Ask if the surgical facility is accredited, and don't trade away follow-up care or emergency planning just to save money up front. Finally, think about the true cost, including what happens if complications do occur, because those won't be covered anywhere and you'll have a tremendously difficult time finding a doctor to help you here. I get it. Wanting to save money is smart, but when it comes to cosmetic surgery, cutting corners almost never leads to the outcome you want. So be smart, do your research, and have your surgery done here. Until next time, be well.